By way of introduction, my name is Richard Lester. I have the privilege of being the chair of the Board of Trustees, and I'm joined here today by members of the Trustee Board and equally those who are online that are joining us for the AGM. It is an absolute pleasure to be able to be in the room with so many of you. I think last year we felt we had a good attendance in person and online, and we probably beat it this year, which is fantastic to see so many of you come along today to hear some of the amazing work and reflect on the year that has passed. Today we want to celebrate and reflect on the work of Involve, but equally think about some of think about some of the challenges that are ahead. And it is a session where you can ask questions, you can get involved, and if you feel you want to at any point, there'll be relevant spaces to ask questions and clarify. So welcome to you in the room, welcome to you online, those that have dialed in via the Teams link, and for those that are watching maybe after the event to hear some of the information from today, you're most welcome. Today is our 49th annual general meeting, as I've mentioned, and it would be remiss of me not to start by saying a huge thank you to a number of groups of individuals who make this event possible, but more importantly, make the work of Involve possible. So I know today we're joined by many staff in the room, volunteers, partners, stakeholders, and those that help to fund Involve. Half or so, we're going to reflect on the last year. We're going to celebrate the successes of Involve, and we're going to hear from some brilliant speakers who have all given up their time to come and speak today. And it'll be fair to say that as we reflect on what's happened in the past, it's important to remember that it's been quite a challenging year and an economic climate that perhaps we would have hoped would be different. We know there are challenges in the sector. There's challenge cross-sector, and cross-service, and that does impact on the work that can and will be done. But despite that challenge, with clear commitment, continued innovation, continued drive and determination from many people, over the last year, Involve has continued to innovate, to provide more support than ever before, and to put those that use the services at the heart of what happens through the organisation, and continue to reach more people than ever before. And we'll hear about that in some of the case studies and stories that we will hear and reflecting on today. Now, we as a board, we have the privilege of hearing some of individuals' stories, lived experiences, and case studies of how Involved has made such a difference to so many people. And we also talk to people firsthand, and I reflect on my own interaction only in the last few weeks with somebody who told me a story about how they were in crisis caring for someone. They were looking for help and support and didn't know where to turn. And they made the call, they made the connection with Involve, and they asked for help. And their life changed, and they explained to me that as a result of their one contact with Involve, the one question they asked, they were then able to access a whole range of services that before that day they hadn't even known had existed. And that is the impact. If it changes one person's life, if it helps one individual, then we know that things are going well. But if you times that by the amount of interactions that Involve have had over the last year, you'll see the power of difference is huge. So despite the challenges that we know of in the climate, the funding and the uncertainty that exists around all of the services across the sector, the organisation of Involve has continued to innovate, create and make a huge difference. We remain one of the largest providers of social prescribing in the United Kingdom and employ the most social prescribing link workers, and are very proud of that achievement. We remain positive about the future and the opportunities to help even more people. We're going to hear today about the new hospital social prescribing services, where innovation continues to extend the reach and the people that are helped and supported. And the team, volunteers and those that work with us will continue to strive to tackle health inequalities. And we hear that firsthand continuously about the work that's undertaken through many people. And there's more. Last year, Involve helped over 11,000 carers who were previously unknown to the system. 11,000 people that without the work of many in this room and beyond wouldn't be able to access the support that they desperately need to ensure they can provide care to their loved ones and those that they care for. And Jane and Nikki later on today are going to talk about the new innovation in the Care for Me programme, which extends the reach to supporting carers even more. And there's even more things that have happened. So the short breaks and young people service, the personal healthcare budgets, which you may or may not be familiar with, but all contribute to what is involved in the organisation we're talking of today. In addition to that, over £450,000 has been secured in the last year for the wider voluntary sector, working with 48 different partners to provide services that complement that of Involve. So it's not all about what Involve does itself. We're very much committed to helping others on the mission of tackling inequality and the root causes of some of the challenges. So today is a huge opportunity to celebrate those things. It's a huge opportunity to say thank you to each and every one of you for your contribution, to reflect on the year that has passed, but equally to think about the year that's ahead. We as a board are hugely proud of the work of every single person that makes it possible, and we couldn't stand here and be so grateful without that continued contribution and effort that comes in many forms. So thank you from us all for being here. Thank you for all that is done to make today possible. For those that have organised the event, it's hugely important. But importantly, for the work that's undertaken by the brilliant people that deliver services, a huge thank you. My ask of you as you leave today is go away and talk about Involve. Shout the messages loudly from wherever you can, and make sure every opportunity you can help us to promote the brilliant work that you'll hear about today, and so that we can continue to reach and help even more people than ever before. So I hope you enjoy the next hour or so in terms of the presentations. Do ask questions. I know it's a big environment and the lights are on and all of those things, but we genuinely want to have a conversation today, and we look forward to meeting you in the break and having conversations as the time goes on together. So thanks very much. I'm going to hand over now to Gary, who is our Chief Executive Officer. Thank you, Gary.
Good morning, or good afternoon, friends. It's a real pleasure to be here this afternoon, and a real privilege to be standing here as your permanent CEO. On the slip of paper, it said that I was doing an introduction, and it's getting harder and harder to do an introduction to Involve Services. We're becoming more of a complex and diverse organisation all of the time. We support carers. We support children and young people through short breaks, through dynamic peer associates, through children's health and wellbeing navigation, and through a range of programmes. We run social prescribing, both in hospitals, in GP surgeries and in the community. And we run community navigation and wellbeing programmes, as well as community transport programmes, green social prescribing programmes, postural stability programmes and more. Underneath all of these programmes is a basic principle. Involve was established 49 years ago, and we were established because of a purpose. Involve don't exist for profit, we exist for purpose and mission. We're a mission-driven voluntary sector organisation. And our mission's right here. Our mission is to connect people. I think there's nothing more important than connecting people in communities, building the social capital of people in communities, making sure people have connections. The difference between being able to pick up the phone when you're feeling a bit low or when you want somebody to speak to, as opposed to not being able to pick up the phone and not having anybody to speak to, is massive. The difference between looking forward to an outing with some friends and actually realising that you're stuck in the same place, looking at the same four walls all the time, is absolutely huge. I read hundreds of case studies every week that come across my desk, and a lot of them tell the same story. A lot of them start with a little bit of a change of life circumstance for somebody. Either their friends went off to university, they lost their job, their partner passed away, and they found themselves a little bit lonely and a little bit isolated. And that got worse and worse and worse until they made that call to Involve. And they met a worker who sat down shoulder to shoulder with them and asked them what it is that they were interested in and what it is that they like doing, and then connected them through their community. And after that, the story changes again slightly. Some people are so inspired that they become our volunteers, helping us to connect more and more people. Other people we don't hear from again because they've got a brilliant community around them that is sustainable and impactful. And other people continue to work with us. The next part of our mission as an organisation is that we promote choice. We're not in the business of telling people how to live their lives. We're in the business of standing shoulder to shoulder with people saying, how can we help you? What is it you want to change in your life? What would that look like? And how can we help you get there? And we'll do that even if we don't agree all the time that's the right or best decision that person could be making. Promoting choice also works in synergy with connecting people, because it means that we're able to connect people to the activities and the communities and the peoples and the tribes that they really are passionate about and have connection to. Finally, we challenge inequality as an organisation, and we know that inequality has grown in society a lot recently. We know that 30% of children in the UK are growing up in relative poverty. We also know that that number goes up to 52% of children of people from the Black British, Black Caribbean and Black African communities. A huge inequality. We know that people growing up in relative poverty have a much higher chance of developing a long-term condition in later life. We know that maternity inequalities exist, and Liz is going to speak about them later. We know that financial exclusion means that the poorest in our community are paying the most for their gas, their electricity and their basic services. So we're committed to working to challenge inequality in all its forms. And this is our magic ingredients. This lays at the heart of everything we do. Connecting people, promoting choice and challenging inequality. And I hope as you hear from all of our speakers today and you hear all of our case studies, you'll hear this theme come through all of the work we do. Connecting people, promoting choice and challenging inequalities. It would be remiss of me before I sit down not to talk about the challenges we face, and Richard touched on them earlier on in his speech. We're facing more and more challenges every year as an organisation, and actually our community are facing more and more challenges. Our partners are facing more and more challenges, and the systems that we work with are facing more and more challenges. For our community, 2 years of a cost of living crisis have left more and more people struggling to pay their bills. We know that loneliness continues to be rife in our communities. We know that access to services is becoming more and more difficult for people. And we know that illness and ill health is increasing in our communities. For the voluntary sector, we know that demand is increasing and funding isn't. And it's getting harder and harder for us to pay our bills that are also increasing. Last year in Kent, 11.2% of voluntary sector organisations closed their doors forever. So big challenges for the sector as well. And finally, for the system, we know that the system are struggling. Financially, they're struggling to meet their budgets, and they're having to make difficult decisions and think about the way that they run services. Quite often overwhelmed. For the NHS, we can read the Darcy report, and it tells us that all the issues that exist in the NHS at the moment. And we know KCC are struggling with huge social care bills and are struggling to make ends meet themselves. In these challenges, we stand resolute as an organisation, and we're committed to working with all of these partners. We're committed to working with people on the ground and communities, and we're going to do whatever we can to leverage every bit of resource so that we can continue to support people the way that we've been supporting them over the last few years. To our voluntary sector partners, we will continue to work with you wherever we can. I said it last year at the AGM, together as a sector, we are much stronger than we are as individuals, so we will continue to work with the sector and partners. And thirdly, the system. We will continue to work with the system and to challenge the system and to advocate for radical different thought and different ideas of the way that we can help people around their long-term health conditions and around their health inequalities. I think with challenge comes new opportunity, and I think there's a great new opportunity for Involve to work really closely with the system to influence prevention and to prove to the system how cost-effective prevention is, as opposed to treating people's long-term health conditions. I'd just like to say thank you to a few people before I sit down. Firstly, I'd like to thank the 26,500 people that trusted Involve to work with them this year, that were brave enough to make that phone call to us and that trusted our members of staff to stand alongside them while they made positive changes to their lives. So a huge thank you to them. I'd also like to thank all the staff and volunteers who constantly inspire me as CEO. Our staff constantly go beyond and above. And finally, I'd like to thank the board as well. I think the board do an amazing job. They're all volunteers themselves, and they take on a huge amounts of responsibility and a huge amounts of liability. So I'd like to thank Richard, Rachel, Duncan, Jonathan, John, Andy, Deirdre and Shelley, and Morty, who's just joined, hopefully joining the board later. So a big thank you to the board for all of your help, your leadership and your governance. And thank you to all of our partners who have worked as other voluntary sector communities in the community to help us deliver all of our services. So I have the absolute pleasure now of handing over to Jane and Nikki, who are going to talk about our carers service work. Thank you very much.
Thank you. Hi, everyone. So you'll see I've got a friend with me again. I like to have a friend with me at every AGM. So I'm Jane, and this is Nick, and we're going to talk to you just about a very small part of our carers service. You've already heard some of the statistics of the amount of carers that we've worked with in Kent. But actually, who knew? There's 158,512 people in Kent who have identified themselves in the census as caring for a family member or friend. So this is huge. It affects all of us, not just people that use our services. 1 in 7 people are caring for someone and trying to juggle work alongside that, and we have quite a lot of staff involved who are in that position. And then in the UK, between 2010 and 2020, there was a slight change in people who were caring. And what happened was the largest group to become unpaid carers, we call them, was those between the ages of 46 to 65. So this is affecting a huge amount of people who are at work. And what we realised, we'd worked with carers that are involved since 1993, was that things were changing and that we needed to change with carers, and we needed to adjust our services and adjust our offer to make sure that we were listening to actually what was needed. You'll see that we actually worked with 5,934 carers, that's just in West Kent, and with a whole variety of things that they would have accessed, from short breaks, personalised with choice and control and brokered to our providers, to an emotional support on the phone. Or perhaps they attended a group and met with other carers. So a really large variety of work. Also, you'll note at the health of those carers that we've worked with. So 78% of them actually had a long-term health condition or a disability themselves. So a lot of the people that we're supporting who are caring for someone are actually not that well themselves. So what have we done? What we did was we started to try and co-produce far more after the pandemic. And what does that mean, really? It meant that we listened to carers, that we listened to actually what they wanted, and that the things we might have done before the pandemic maybe weren't so relevant now. People's lives had changed. People had become more isolated. Their caring role had changed. They were juggling work alongside caring. So what we did was we promoted the wonderful Nick into a new role that we developed, which was training and engagement coordinator. We also looked at our offer to young people that were accessing the carers service. So those young adult carers between the ages of 16 to 24, often who are living in poverty, often who are not accessing education or employment because of the situation they're in. And we recruited a younger member of staff called Chelsea, who unfortunately can't be here today. And the reason we did that was we listened to those young adult carers and actually who they wanted to engage with. And we've worked with them throughout the past year to develop lots of different things. So what happened was Nick started to build engagement forums. We really opened up things again into the community. We invited carers to come and talk to us. And from that, we've developed a whole different suite of activities that have been planned and produced with carers. So I'm going to hand over to Nick, and she's going to talk to you a bit more about what that actually looks like.
Thank you. Hello. So the community navigators that involve, they're daily working with carers firsthand. They hear the difficulties that they face, what would be helpful to them. We're also constantly asking for specific feedback about what things, what skills and information would be most useful to carers. And that information has shaped all of the things that we have been setting up. The carers course then, which we've called Caring and Me, is pretty much the key part of what we offer. 6 weeks where we cover key topics and where carers themselves, and this is really important, get to share their own knowledge, their own tips and hints, and just advise each other and empower each other. And critically, the groups get to know each other really well. And a lot of people who have participated in the course have gone on to form their own support groups. They message each other, meet up with each other, and are there for each other. Now, carers also have often expressed a concern around, are they doing the right thing in their day-to-day care of the person that they're looking after? And because of that, we've organised workshops around moving and handling and around first aid. And those empower carers and the participants to confidently assist the cared for whilst looking after their own physical well-being. A big part of the Caring and Me course is around carers looking after their own mental well-being. Of itself, actually, the course provides a space where people can just be honest and share about their lives. But building on that, we provide small groups where people can come and meet together, whether that's over a cuppa and a biscuit, or whether that's joining one of our walking groups or our online group. So they can just share with each other and provide support. We've also recently added anticipatory grief and adapt and recover courses where carers can explore the emotional impact of becoming a carer and build their own resistance. Highlights of the year include our forums, which we hold quarterly, where carers have a place where they can ask questions, express their own worries or concerns, and hear from speakers. And again, we invite speakers based on what carers, the information that the carers have said they want to find out about. One of the hardest things for people who find themselves in a caring role is the isolation that develops. And so every single one of the groups and workshops that you can see on the screen behind me is developed in a way that it allows plenty of time to build connections and to start networks where carers are able to then go on and offer continuing support. So I think with practical workshops, with guidance and advice around and from other services, opportunities to build relationships with other carers, and space to use their own knowledge and skills to support and empower each other, we are definitely helping our carers to live healthier, happier lives. In fact, just yesterday, I opened an email from a carer who wrote, "Thanks again for your lovely, kind support. I'm not sure I would still be here if it were not for people like Involve and the support that you give." So it's a good foundation, and I'm looking forward to building on that and working and continuing to work with carers to develop more workshops, more opportunities. And one of the things that we have added to what we do is we've ensured that there are online opportunities and some of the things happen of an evening, again, taking account of those carers who are working. Because it is a great privilege to look after another human being and to help them, but it can come at a huge cost. And it can be very difficult and painful and lonely. And this is beautifully expressed in a poem that I would like to share with you. During Carers Week in June, we invited people to express what it means to be an unpaid carer. And this is the winning entry, called I'm Here. I'm here. Don't worry. I'm here. Don't worry. I'm tired, but I'm here. I'm exhausted, but I'm here. I'm here. I'm not ready, but you are. I'm not showered, but you are. I've not eaten, but you have. I've not slept, but I hope you have. I've not finished the dishes, the washing, or the rest. I never finish anything. I'm here. Don't worry. I'm here. Don't worry. I worry. What if I'm not here? I fret. Am I doing enough for you? I forget who I am. I forget who I was. I forget. I hear you. I'm here. Don't worry. We're now going to listen to 3 case studies which have been read by members of Involved staff.
Life was getting really tough and I was becoming more and more isolated. I'm caring for my husband who has heart failure and COPD and is in and out of hospital regularly. At the same time, I'm supporting my adult son who has additional needs and needs my support to care for his son. I'm living with arthritis and diabetes, and I found I was really struggling with managing everything and wanting to know what support was available to me as a carer. My GP referred me for counselling for my anxiety and depression and put me in touch with Involve. Involve got in touch with me really quickly and immediately sent out a carer's emergency card and identified that transport was an issue for me as I don't drive. They supported me with information on volunteer transport groups. I was offered a carer's assessment and given information about the Caring and Me course, which was starting early in the new year. The carer's assessment gave me an opportunity to discuss my caring role and begin to put plans in place. I realised I needed support and an outlet for me to share my experiences and share strategies. This is what the Caring and Me course provided. I was able to share my own experiences, to support other people and learn from them at the same time. I really enjoyed meeting people who have similar problems. The information given was so helpful, and being able to talk things through in an open and honest way was beneficial to all of us. I would certainly recommend this course to other carers. At the Caring and Me course, I also met someone who is in a similar caring role to myself. We have kept in contact and have met for coffee. This additional support and friendship have meant a lot to me. Because of the encouragement from Involve, I am now asking family and friends more about doing things together so that my husband and I can get out. Also asking for help with someone to stay with my husband so that I can get out for a break. This has been so beneficial and helps me to cope with my different caring roles. I feel confident enough that I can reach out to Involve if there are any changes that I need support with.
My life felt a bit of a mess before I met Chelsea from Involve. I was struggling to manage with day-to-day life due to caring for my mum and younger brother, alongside completing my studies at college and maintaining my own mental health. I initially came across Involve at a pop-up store event at Hadlow College. During this period, I was feeling very worried about my mum and needed someone to talk to. I met up with the community navigator once a month at the college, and I found these meetings to be immensely helpful as I was able to talk about my thoughts, feelings and worries openly without being judged. I've been in and out of work since I completed my studies at college due to my mental health and well-being and the pressures of my caring role. There is a notable pattern of me pushing myself into work and then my well-being going downhill and no longer being able to work. Involve referred me to Sure Trust for support with my search for employment. I completed my carers assessment and support plan in March 2024 with Chelsea as I recognised the benefit of this. It provided me with an opportunity to talk to someone about my caring role and the impact it has on me in different areas of my life, and ensure I was receiving the right level of support. During the assessment, I shared with Chelsea the difficulty I was experiencing applying for benefits. I was feeling embarrassed about applying for benefits, as I believe there is a stigma attached to this, of being lazy and unwilling to work. Chelsea has since supported me to complete an application to Universal Credit as an avenue of maximising my income while I improve my mental health and well-being, so I'm able to return to work. I would like to move out and live independently. Chelsea has supported me to complete an application for the Housing Register. I have been in regular contact with Chelsea and signposted to mental health and wellbeing support. I am invited to young adult carer groups and activities. I hope now I am receiving the right level of support to better manage my caring role. I am now able to attend these more frequently. The support I have received from Involve Kent has been brilliant. I can manage my life a lot better, and at times I experience challenge, I know I can contact Involve for support.
Thanks, everybody. I hope that gave you a taste of everything that we do on that carers work. I'm really delighted now to invite Rachel Jones to come up and speak. Rachel Jones is Director of Strategy, Planning and Partnerships at NTW. Thank you, Rachel.
I think I should have worn higher heels. Can you hear me? Yeah, excellent. Okay, thank you. So, as Jane said, I'm Rachel. I work on the board of directors at Maidstone and Tunbridge Wells Hospitals Trust, and as you said, they've given me this great long job title so that I have to do anything they tell me because it's somewhere in the title. But I guess because of that, I have the absolute honour and privilege to work alongside colleagues in the room in something that is the West Kent Health and Care Partnership, and not only as my role as a director at Maidstone and Tunbridge Wells, and Gary and I work together directly on that partnership. And it's been an absolute revelation for me, actually, the whole experience of understanding a much wider system outside of the hospital walls, which I've worked in for a very long time, has been an absolute privilege. And I guess I wanted to say that we're now working together within Maidstone and Tunbridge Wells on a particular scheme, which I am going to talk to you about. But we work actually on many more things, particularly around health inequalities and the impact. And I guess some of you will probably recognise that a lot of big acute hospitals have never necessarily seen their role actually in health inequalities and improving health inequalities. And I think that things are really changing. And certainly they're changing in West Kent, and certainly they're changing in Maidstone and Tunbridge Wells Trust. But that's really because of our partnership with Involve and the work that you do and we're able to see. It really helps us understand how we can be a part of that and add some value to those things. And so about 2 years ago, I'm going to focus on the last 12 months or so, but about 2 years ago, we went into partnership with Involve together to look at social prescribing in both our emergency departments, but also on our wards for patients who were either ready or becoming ready to go home, but who had some challenges in doing so. And as I'm sure you can imagine in both scenarios, we're seeing people when they are at their very worst sometimes, when they are very anxious, very stressed, or in poor situations. And so it's an absolute privilege and honour to be able to help them. But sometimes in the NHS, and I'm not criticising ourselves, but it really is a question of we've just got so many people waiting to come through into those places, into our emergency departments or into our beds, that actually we lose the opportunity to look at things a bit broader for people in a bit more holistic way, and it's been really proud to say that Involve have helped us do that. But I just wanted to give you a flavour before I tell you about the scheme of the sorts of numbers of people we're talking about. So every day between Maidstone and Tunbridge Wells, we see between 750 and 800 people through our emergency departments every day, and we are discharging home somewhere between 30 and 40 patients a day from our hospital beds, of which there are about 640 beds across the two sites. So just to give you a flavour of the size of it. And so what did we set out to do? Well, this was a bit of a test. In my career, I've never seen anything like this before, but we were really looking to see if we could support people in a much more holistic way that were regularly coming to our emergency departments and that were waiting to go home. It was really all about the connection that we've heard about today, all about that personal support, that understanding their individual story, that connection with what they might need help with, and being able to support them outside of hospital. So we started the service, as I said, back in April 23, and I'll be the first to acknowledge and admit that it took the perseverance of people like Jane, and we'll talk about this in a second a bit more, but we struggled against all sorts of issues, things like data sharing and information governance, and actually having people that weren't employed by the Trust on site in our ED departments and working with our discharge team. And it was very frustrating. I won't sort of cover that up. And I guess the thing I wanted to share that with you is so that you understand that we've learnt lots of lessons. This isn't just about social prescribing. We've learnt lots of lessons about how to work together, how to navigate those barriers, how to break them down, and what we'd need to do differently in the future. But after much perseverance and actually working off-site for a number of months, we finally did get colleagues being able to work on site in the hospitals. And so I just want to share with you where we are sort of more recently and just give you again a sense of the numbers, because as you can imagine, it took a little bit of a while to get up to its full speed, given all of the challenges that were put in the way. But over 450 referrals have been made from April 24 to now, and that grows every day. We've got over 380 people with support plans in place, and over 200 referrals made to other services to connect people in lots of different ways. They do an invaluable, the people on the front line here do an invaluable service in not just doing the doing with our patients and their families and carers, but also with our staff. We employ nearly 8,000 people, many of whom live in our communities, including me. And so the training and the education and the experience that those teams are getting, our ward teams, our discharge teams, our therapy teams, you can't actually ever put a value, a price or a value on that, other than to say that it ripples through the entire community that we live in, because all of these people have got friends and family outside of work, and their experiences in work with us touch so many people outside of that. And I guess what I want to finish with, and I'm not going to read these out because I thought the videos are humbling, and I think this is humbling too. In fact, when I read some of the case studies, you know, it's hard not to have tears in your eyes listening to what a difference it makes to people. But ultimately, the themes that have come through all of the speeches this afternoon, I'm doing the same as you, Gary, it's this morning, that have come through the speeches this afternoon is when people are in crisis and they're overwhelmed. It's really hard to see the wood for the trees. It's really hard to know where to go. Often people feel like they're failing. Often people feel like it's a failure to ask for help. But when help is given and it's there and it's at the front door, that's a very different scenario. And I think the face-to-face part of it is incredibly important part of this service. But what without fail these examples, and they're just a very small selection, show you, is that people feel without it, they couldn't have done it for themselves at that point in their lives, that things were so desperate for them and so difficult that they would have gone under. They don't know how they would have coped. And I guess as human beings, we can all relate. We've all had times in our life probably where we just haven't known where to turn, but maybe we've got a better support network around us and so it's easier. But for these people without social prescribing, they wouldn't, I believe, have been able to achieve and go on to be so positive about their lives. And I just want to give example, because it's the one, and it's actually not in here, but it's the one, Gary, that sticks in my mind. We had a lady who had a long-term health condition who was really struggling and was in and out of our ED department. And so we do look at things like what we call frequent attenders to say, can we do something different? Can we help rather than just patch up, turn round, send out again? And actually, this lady agreed to meet and speak to Involve. And actually, the whole situation was that the drugs that she needed to be kept in a fridge. And so there was no fridge where she was living, and there was no bed. She was sleeping in a mattress on the floor. And so her health condition was exacerbating, in and out of hospital, feeling really low, not able to go out anywhere or see anybody in case she became unwell while she did so. And so just by the simple act of connecting arranging and getting a fridge. I don't know how you did that, by the way, but there was some fund, and a bed. And actually, the change that made to that person's life, as I said, was phenomenal. And then that person's never looked back, not just from a health perspective, but from an enjoyment of life perspective. So that's the scale. That's the scale of the change that this service makes and didn't exist before we started this work with Involve. And so I'll be eternally grateful for the opportunity. And I'll promise with Gary, we'll do everything we can to continue to work with Involve to keep the service going. At the moment, we tried it out until April 25, but I have got no doubt in my mind or our minds that is something that has added such value, and as I said, something we should absolutely continue with. But I know, Jane, we're going to look at some case studies now around this service. So do you want to come back and join me? I think my final slide is just to say, I think that the work that all of the people do, not just in the room, but outside of the room, and all of the connections you make with different groups and opportunities and charities is just amazing. And it's made an amazing difference to hundreds and hundreds of people's lives that are, at the time they come to our emergency departments, you know, at some of the lowest points in their life and probably feeling the most scared.
Thank you. Hi, everyone. So Rachel's spoken about our partnership, and so I thought it would be good if we speak a bit more about the impact of the work on people. So obviously people know us as a social prescribing provider, but actually this is what I would say social prescribing plus, because we've learned a lot with this work. So as we said, we've got 3 link workers and they have access now onto MTW's site. However, they spend a lot of time visiting people at home. They might pick up those referrals at the hospital, but it's really important, and what we've learned is that people really need a visit in their own community setting or home for us to be able to work with them. We work with people for up to 6 weeks. And then after that, if they have any other needs, then we are able to move them into some of our other services as well. And really what we're there to do is to work with patients where there may be social or isolation needs that are meaning they're coming into hospital with unplanned admissions, or they're coming into A&E on a frequent attendance, and the staff are not quite sure what's going on with them or what keeps bringing them to A&E or into hospital. Those of you that know me well know that I always talk about the ESTER model. This is actually, I believe, the best way to work with people to then reduce unplanned hospital admissions. And those of you that have seen our previous data on social prescribing and navigation will know that we have proved that works, so we hope to do the same here. The ESTER model originated in Sweden, and it came over into the UK in 2016, and we've adopted that approach to working at Involve. Esther's a fictitious person. They're anyone with complex needs requiring care or support. They can be any age or gender, and their needs can be physical as well as mental and social. So this is about making sure that we work with people in a person-centred way, hopefully to reduce hospital admissions where they're not needed, and also perhaps the length of stay as well, helping people to get out of hospital quicker and when they're medically optimised, and removing those social barriers for them. And also, really important, improve skills of our workforce. We've really noticed at Involve that the staff that work on these services, although undoubtedly they're challenging, we have really good staff retention as well, and I think that's because the staff are given quite a lot of freedom in the way they work with people. Making sure there's enhanced quality of care, and as I said, that positive impact on recruitment and retention, which is really, really important to us. We're nothing without our staff and our volunteers. And also making sure that we get feedback from the people that we work with as well. What did they think went well? What didn't go well? And working in that no-blame way so that our staff are empowered to make changes to the way they work. What we've learned is that when people are being discharged from hospital, and they are people that are being referred to us because they probably have many social needs, a signposting and referral approach is absolutely not going to work. So the staff that work on this will visit people at home, really quite quickly after they've been discharged. And they do really practical things as well. You can't work with anyone about how isolated they are until you've sorted out that they've got food, that their electricity's working, they've got their medication, and they've got clothes to wear. So the staff have done some really practical things on this as well, working with people really closely to get them into the best position and to ensure that they don't go back into a hospital unnecessarily. So they've done lots of things, as Rachel said, like purchasing beds, helping people to purchase clothes, other household items, sorting out their bills, making sure that they're getting the best deals for everything, filling in loads and loads of forms, whether that's online or paper. But what they're trying to do is work with people and empower them to be able to do these things for themselves going forward. So sharing their knowledge. If they're making a phone call, the person's listening in, and hopefully they'll be able to do that next time. And obviously referring into services and activities and supporting them to access them. We've got some really great patient outcomes that are self-reported. So the staff that work on this ask a certain amount of questions when they first meet people. Those questions also open up a lot of other conversation as well. But also we review everybody that we work with. So you can see here how people's lives have improved in quite a short time. So things like their life satisfaction increases by, on average, 25% for anybody that accesses this hospital social prescribing. Even in a very short time, there's a decrease in people's loneliness as well. It's smaller than on perhaps some of our other services because this is a short-term service and a lot of practical parts to it. But even people's physical activity, so we talk to people about how much they're going to move around and how they're going to make sure that they recover from whatever it is they've been in hospital with, and then helping to connect them further into other physical activity. That might be something like falls prevention, or it could be just accessing something that is a group activity. So the outcomes are really, really good. However, we're not complacent. And we know that there's lots more that we need to do, working in partnership with MTW. We know that we need to try and embed the service further into A&E. That's been quite challenging because of the obvious busyness of the environment in A&E and our access actually into A&E for our staff. We also need to work with the NHS to be able to run the data on the people that we've worked with. We always collect NHS numbers. We ask people's permission to do that. And that means that later on we'll be able to run data through MTW systems to see, actually, has this reduced unplanned hospital admissions? Has it reduced people's A&E attendance? A big thank you to the staff on this as well for sticking with this work, because as Rachel's already said, it was really massively challenging to get everybody to have access, but everyone is on site now, and the feedback from the staff that you work with is always massively positive. And of course there was some scepticism at first. You know, when you work in a medical model, us turning up and saying, what about people's social needs, can be quite hard for people in that environment to take on. But I think by hearing some of the case studies, which are read by Michelle.
I suffer from severe agoraphobia, anxiety, paranoia, depression and OCD, along with a number of physical health conditions, including a life-threatening autoimmune disease, and I am unable to read and write more than basic sentences and words. Before I accepted support from Involve, I felt unsupported and alone. I could not leave my flat, and I had discharged myself from hospital before I was ready. I accepted support from my hospital social prescriber after they had brought my medication from the hospital. I had not received this due to discharging myself early. My hospital social prescriber understood that my behaviour, language, tics and lack of eye contact are all part of my conditions, and she gave me the time I needed to trust and think about letting someone help me. My hospital social prescriber supported me to contact my GP to sort out a number of things, including arranging to get a fit note for my universal credit. She then collected this for me and delivered it, as I could not do this myself. She also organised for a shower stall and a perching stool to be delivered to my home to enable me to stay independent. She knew how hard it would be for me to accept the delivery, so made sure I knew when it was coming, so I had time to prepare myself to open the door.
My hospital social prescriber talked through how to get a Motability car through my PIP benefit, all the costs and the options. She arranged for me to visit a Ford showroom, and with the help of my neighbour and her, I was able to get there, and I now have a car that is a safe space for me. I'm able to get to my medical appointments and do a food shop at quieter times. She was able to help me with my universal credit claim, notifying them of a change in my circumstance, and then help me with the form that came with this. I'm hopeful I will receive additional funds now that Universal Credit are aware of my increased difficulties and needs. I was very worried when I received a letter from social services advising they wanted to talk to me about longer term support. My hospital social prescriber assured me she could be there when the social worker visited, and it now looks as though I may be able to receive long-term support with the things my hospital social prescriber has been helping me with. Having this support has changed my life. I can now do things like leave my flat, which I thought I would never be able to do again. I can see now that I can have a good life, though I still struggle to accept the limitations I face that will not improve. I am, however, beginning to enjoy my life, and I cannot thank my hospital social prescriber enough.
Big thank you to Michelle for those wonderful case studies. I'm really pleased to hand over to Lizzie Lowry-Crouch now, who is our Head of Partnerships and Innovation.
Thanks, Jane. So I'm Lizzie Lowry-Crouch. I'm the Head of Partnerships and Innovation. I'm going to be talking today about some of the engagement work that we've been doing over the last 2 years. So in the last 18 months, we've really noticed a huge increase in interest for engaging with communities to help improve service design and delivery, particularly amongst groups who we don't necessarily always hear from. But we do know it can be really difficult to engage with these people, and the implications that that has is that their voices aren't heard and services are not representative of their needs. However, Involve is really well placed as a community organisation. We're established, we have really good links into the community, and we are trusted. So we've been working on a number of different engagement projects. The one I'm going to talk about today is around our maternity core connectors. So this is linked to a national programme which is delivered by NHS England, and the idea is to tackle health inequalities amongst 5 clinical areas in the most marginalised groups, so areas of high deprivation and other health groups. One of these specialities is maternity. So we know from data that Black women are 4 times more likely to die during pregnancy or after childbirth. Asian women are 2 times more likely. So there are huge inequalities present in maternity care. So we worked with Kent and Midway ICB on a Community Connectors programme to begin to address some of these inequalities. The programme had a sort of a 2-way function. So one part of that was to have our engagement officer and a team of volunteers in the community who would speak to women about the experiences that they had. The project was focused in DGS, so North Kent, where there are areas of high deprivation, also much more diverse groups, more women experiencing inequalities. So we went out and we spoke to over 350 women about the experiences that they'd had. Some were good, some were not good, and we do have some of that to show you this afternoon. And the other part of the programme was that we had people based out in the community who could provide information about maternity services. So we have volunteers that had information that talked about what antenatal care is available, what scans you should be attending, because there were many women, and still are, that don't know what's available to them, and if they miss that early care, it can lead to complications in pregnancy and in their childbirth. Oh, it's missed my slide with the video. As part of this project, we are producing a video that brings together the voices of the women that we spoke to. We thought it was best to hear directly from them rather than me telling you their story. And as we found already today, it's quite impactful. to hear from them directly. So I am really pleased, hopefully, to have a small clip of that video to show you today. The final thing isn't actually finished yet, but should be shortly. Oh, it's in the wrong order. Sorry.
My second pregnancy, 2019, right? I got far to 23 weeks of gestation. The second after visiting my midwife, I just started to have contraction and bleeding, so I had to reach to A&E, which they sent me to Tamati. And there I was seen by the consultant, Dr. Rana, if I remember well, was her name. She kindly explained me that there's nothing that I can do, and just lose my baby. So with my son, was not the best, and I'm happy that I get the opportunity to talk about, because I think there's much to learn from this. I mean, the moms should always trust their gut, and even if they are wrong, just go and ask for an extra visit, I don't know, anything that you feel that it needs to be done for reassurance. And from medical staff, I think they just need to listen and to look at what the person in front of you is bringing up, and to think maybe this is important. Or if it's not, it's not, but at least you pay attention to details. And I think that would make a big, big difference.
They were very clean, they were very respectful. That's just one lady. She was the only one who was just, not mistreat me per se, but she would, sometimes I would ring the buzzer and she would just pretend not to hear. But apart from that, it was good. She told her, if you carry on like this, even her, luckily, I think one of the doctors is her boss or something. Told her, if you carry on, I've been hearing a lot of negative things. If you carry on like that, you're fired. And then the lady should have been more professional, whether she likes me or not, whether she does. She should have been more correct, because that's her job, because that's what the midwife does.
Mums Link Up is just about, it's a community group, and it's just for mums to come in to share their experience, get knowledge. We've got over 300 mums in our group, and we've got different mums we've got midwives, we've got GP, we've got different professionals. And then I guess what mum gets is, especially if you're a new mum, you don't really have anyone, if you don't have anyone to relate to, or sometimes even if you do, it's best for you to speak to other mums who have maybe gone through the same thing that you're going through, and they can give you advice.
So that's just a small snippet from the full video that we'll have. There'll be a bit more context around some of those individual cases, but I think you'll agree that it's much more moving and impactful to hear that directly from the person that said it. And I'd like to extend my thank you again to the ladies that did come forward and agree to be filmed. So we've taken the feedback that we collected in that part of the project and are working with the relevant services to hopefully improve things for women going forward. And that was actually the motivation for a lot of the people that we spoke to. They would say that they're happy to share because they don't want it to happen to somebody else, and that was really powerful. So we're positioning ourselves in a way that we can take on more engagement work and to do more work with communities that maybe aren't heard so much in things like service design and delivery or health research as well. It's offering a huge opportunity for us to become leaders in that area and to pave the way for other voluntary sector organisations to do the same. It also gives us an opportunity to share good practice in how to do this and and we've done some really good examples so far of engagement work in the community. I'd like to hand over now to Katie Abson, who's our Head of Children's Services.
Good afternoon, everyone. I'd like to tell you this afternoon about how we've embedded personal health budgets into children's health and wellbeing services into the voluntary sector. So personal health budgets, in this instance, are funds that we allocated to the support diagnosed or suspected to have autism and ADHD. This was driven by the fact that I think we're probably all aware that waiting times across our nation, but also in Kent, unfortunately, waiting times for assessments and diagnosis are extremely long, and in some areas, 4 years plus. And so transformation is needed, and that's been recognised throughout Kent and Medway. And this innovation, our personal health budget pilot, was set up to provide support where traditional funding streams weren't appropriate to support these families. And you can see here from the figures that per person, the budgets were actually really quite small in both our prevention and our crisis streams. It came about because we were approached by Kent Medway ICB and our colleagues at Kent County Council to be able to provide these two funding streams. The first was early intervention. So that was to provide early support to young people so that we could minimise the risk at an early stage, the risk of their needs escalating. And those referrals came from our own involved children's health and wellbeing navigators who are based within GP practices throughout Kent. The second funding stream was the other end of the scale, working with families where we were preventing crisis. This was in collaboration with Kent County Council and their dynamic support service. This was to support young people at risk of or requiring mental health support through inpatient specialist provisions. So the referrals started to come in, and we very quickly realised that to really truly provide a personal health budget, you have to take a whole person approach. Themes started to come through very quickly, that the young people were struggling with many challenges, often around social communication, social interaction, sensory issues, emotional regulation, frustration and anger. And those challenges were impacting one or many parts of their lives. Some of the themes that we saw around school attendance, family relationships, friendships, sleep, young people feeling isolated. And so Ellen, our personal health budget coordinator, created a framework from the ground up, which was specifically designed to support families to identify what mattered most to them, and then tailor solutions to meet those specific needs and their outcomes and desires. And the bottom line is personal health budgets promote choice. And I hope that this extensive list here, I won't expect you to read it all, really shows how we were able to unpick with families what specific item or service would really make a difference in that young person's life. And quite often they were really what you might think of as quite small, insignificant things. Just to give you an overview, 48% of that first funding, the early intervention, was actually spent on sensory items. So that might be things like weighted blankets, seamless clothing, sensory lighting for somebody's bedroom, or ear defenders. 26% of that funding went to help a young person to start an activity or have some sort of a sport-based outcome. But then with our crisis prevention, it was a different story. We actually used that funding in a much more bespoke way. An example of that was where we were able to fund some carer support so a young person could go to a concert that they wanted to go to. So we provided over 300 personal health budgets during that period. And you can see here from the figures that across the spectrum of well-being, we made improvements. We saw increase in our outcomes. In emotional well-being, up to 52%. But the question that was most important to us was, to what extent did your personal health budget allow you to achieve your specific outcome? And in both funding streams, we achieved 8 out of 10. And 10 really was where the outcome had been achieved completely. So I think we really had achieved what we set out to in that area. We learnt a lot as we started delivering this programme. We had to tweak as we went to make sure that we continue to personalise the health budgets that we were using, and also while we were trying to develop a service which we hadn't delivered before. And we're really fortunate that we're able now to take that learning into another year of pilot funding. We're going to be focusing specifically on those children and young people who are sitting on the waiting list for all that time, of which we know that there are thousands throughout Kent and Medway. We're also going to be able to continue to provide the crisis prevention funding. We're going to roll out the opportunity to refer into the Personal Health Budget Fund wider, to the wider community of children and social prescribers who are in primary care across Kent and Medway. We're also fortunate that we're going to be able to embed this offer into the new neurodiversity support pathway, which is currently being rolled out in Maidstone, but is going to be county-wide shortly. And we've collected all of our learning and our evidence, and we've detailed that in a personal health budget paper. And that's going to be published shortly after this AGM. You'll be able to find it on our website, but we'll also be able to deliver that wider as well. So we're going to hear now from Ellen, and she's going to tell us about a couple of cases from her point of view of helping a family to ensure that those personal health budgets really did achieve the outcomes that we set out to.
When Sam first came to us, he had been diagnosed with autism, sensory processing disorder, and showed traits of ADHD. He was struggling in loud environments, and as Sam used sign language to communicate, he would often make the sign for loud and cover his ears in noisy settings. Sam was waking up multiple times throughout the night and could take around an hour to settle back to sleep again. Sam would also hug Mum tightly at bedtime to soothe himself to sleep. However, this could sometimes hurt Mum's neck. Sam was seeking sensory feedback from standing on items such as books, and bright lights could cause him distress. Mum was finding it difficult to take Sam out the house because he could struggle with the environment, which limited how often Sam could go out, but also impacted his sister and his mum's well-being. Sam's Children's Health and Wellbeing Navigator identified that he needed some support with his sensory needs, so made a referral for a PHB. I then contacted Sam's mum and discussed various items which could help to address each area of need for Sam. Sam's mum had done a significant amount of research into his health conditions and the sensory items which were recommended to support him, so we were able to come up with a really comprehensive PHB package, which consisted of ear defenders, a weighted vest, weighted blanket, sensory playmat, a blackout sensory den, and a small selection of sensory lighting, which were all purchased and delivered to Sam's house. I got in touch with Mum around a month after the items were delivered to see how Sam was getting on with them, and I was so pleased to hear that things had been working really well for him. Mum shared that all the items had been excellent. The ear defenders were allowing Sam to go out in crowded places and enjoy himself, which would have been extremely difficult before. I was thrilled to hear that Mum had taken Sam and his sister to the Christmas lights turn on in their local town, and despite this being the sort of situation which Sam would have really struggled with in the past, he asked for his ear defenders and he was happy. Not only was this the first time the family had been into town in over a year, but Mum described it as the best experience they had ever had when going out the house. Mum shared that Sam was loving the sensory playmat and used it exactly as she predicted, lining it up so he could walk along it like a path and licking it for the sensory feedback. Mum said she tended to leave the items in a trolley and he would always go to get the playmat straight away. Mum felt it had almost become a part of him and his everyday play. Sam was also loving the blackout den and would take great amusement from going inside it, and Mum felt it was providing a safe space for him. Interestingly, Mum shared that he'd started to tell her that there was a spider in his bed, which he was scared of. However, this was the first time Mum had seen him use his imagination, so she was really pleased to see his progress and wondered if the new items had helped to spark his imagination. She could also use the sensory lights, particularly the dinosaur ones, to help scare off the imagined spider. Overall, Mum had seen a real improvement in Sam's behaviours and said that the different groups and professionals that they had met with had also commented on his progress, saying that eye contact had improved and that he was playing much more nicely. He had also started to engage more with his sister, something which was new for him, and Mum felt that the sensory items had a big impact on this. Overall, the PHB was a real success, and I'm so pleased that just a few items were able to have such a profound impact on this young person's life.
I'm going to hand hand over to Gary, who's going to bring this part of the session to a close.
Thank you, everybody. I'm sure that you've all been as interested and inspired by those presentations as me sitting there. We run 26 different programmes that involve, and today we're able to demonstrate just 4 of them to you. And actually all of those case studies that flashed up on the screen are part of our bank of 26,550 case studies. So a huge amount of work that's been going on, which is much wider than the work we've been able to show you today. Anybody who's watching this, do get in contact with us. We'd love to have further conversations. Just before we started today, I was chatting to a gentleman about doing some volunteering for us. So if anybody's watching this and wants to work with us a little bit more, wants to learn a little bit more about Involve, please do reach out. For now, we're going into a short break. We're going to break for 15 minutes. So we'll be back at about 3:20. We're coming back for our short formal AGM, which is just a very short meeting that we have to have legally every year. We'd love you to join us for that short meeting. Last year we did it in 12 minutes, so it won't be a long meeting. But for the time being, there's tea and coffee and refreshments waiting for you. Please do come up and chat to our staff and chat to some of the speakers today, who I'm sure you'll agree all did remarkable presentations. So thank you so much for coming, and thank you so much to our speakers.